live webinar because we had some technical difficulties during the live webinar, but thank you so much to everybody who attempted to attend our webinar on joint disease in pets, what you may not know and how to take a holistic approach. Let's get started by talking about signs of joint disease in dogs, because it's not always an obvious lameness. It may be something as simple as trouble with stairs or being slower on a walk. They may be slower to get up from lying down or have a stiff gait. They may be unable to jump up onto furniture when they used to be able to. They can also have more subtle signs, such as just sensitivity on petting of certain areas, particularly the back or the hip, or they can have persistent licking of certain joints, especially the carpus or similar to our wrist. Cats, the signs are pretty similar. They can have trouble with stairs, a stiff gait, and be unable to jump up on furniture, including cat trees and cat shelves. But cats can also perhaps be unable to get into the litter box consistently, causing them to either defecate or urinate near the box, but not necessarily in the box. Cats may also have more subtle signs, such as sensitivity on petting of certain areas or persistent licking of certain joints. So where on the body is joint disease likely to occur? In dogs, joint disease will tend to occur in the hips, the stifles, which is equivalent to our knee, the elbows, back or intervertebral disc joints, the carpi, similar to our wrist, and the shoulder, kind of in descending order. With cats, they don't tend to get as many different areas, but they can also get hip, knee or stifle, elbow, and shoulder joint disease. Let's talk about causes and contributing factors. Starting with genetics. Genetics can be a big cause, things like medial luxating patella, which is a kneecap that moves in and out of the groove because it didn't form properly. Hip dysplasia is another potential genetic cause where the hip joint didn't form properly. Elbow dysplasia. Shoulder OCD is actually a condition. It stands for osteochondrosis dissecans, which is a condition where the cartilage actually starts to peel or dissect away from the bone, and it can be very painful. We can have inherited conformational disadvantages in patients such as long backs and short little limbs. There are many inherited neurologic mobility problems, which while not joint disease, though can appear very similar, so it's important to distinguish. We can have development and early nutrition problems, such as growing too fast, especially in large breed dogs. We can have delayed closure of the growth plates, leading to the long bones being longer and the animal being taller than it should, which throws the joints off. Loss of sex hormone production, which actually can lead to delayed closure of the growth plates. This also can put certain breeds at risk for other serious diseases later on, such as cancers. We recommend at our hospital spaying and neutering being delayed until 12 months of age for dogs under 30 pounds and at least 2 years of age for dogs over 30 pounds. And we also encourage people to consider something called an ovary-sparing spay or a vasectomy instead for pets that don't have any behavioral problems such as marking, aggression, or running away and escaping. Inflammation of joint disease, and inflammation, the causes of inflammation can range from injury to immune attack, things such as lupus, to infections, Lyme disease, Ehrlichia, and Anaplasma. A contributing factor is stress on the joints. Stress on the joints can be caused by obesity, can also be compensatory, perhaps when other limbs are affected or other parts of the body are affected, and then there's the weight is being shifted. For example, dogs that develop carpi or wrist problems due to back problems and shifting of their weight forwards, or dogs that develop lumbosacral issues because of hip problems. They don't want to fully extend their hip, they start shifting their pelvis up and down, causing excess movement in the lumbosacral area, which then leads to lumbosacral joint disease. We can have immune attack on connective tissues, which may be related to vaccination, and we're going to talk more about that in just a minute. Certain pharmaceuticals can actually have a direct effect on the development of cartilage in joints. Some of these include certain antibiotics. They specifically say not to be used in animals under 6 months of age. NSAIDs, or non-steroidal anti-inflammatory drugs, as well as steroids, can actually help destroy joint tissues. There have been studies that have determined that NSAIDs are actually a cause and a concern for joint deterioration in canine and human patients that receive these drugs in a long, ongoing manner. Lastly, we have injury, but I think in all but the most athletic dogs, joint disease from just injury without any other predisposing cause is fairly uncommon. We'll talk a little bit more about immune attack on connective tissues, particularly vaccination, because vaccination has been frequently associated with the development of antibodies to collagen and other joint-related tissues. Vaccination may also contribute to certain muscle diseases that we don't think we know the cause of, perhaps fibrotic myopathy. Collagen is found in an abundance in the joints and connective tissues of the body. In fact, it makes up 70 to 90% of our muscles, tendons, ligaments, and other joint supporting tissues. So when collagen breaks down, the joints become less stable, muscles and connective tissue loosen and become more brittle, and then disorders such as arthritis, degenerative disc disease, tendinitis, and overuse injuries are more likely to occur. Cranial cruciate tears are becoming very common in dogs, as well as luxating patellas and elbow dysplasia. Vaccination has been implicated in cases of polyarthritis, poly meaning more than one joint is involved in dogs. There have been several studies in both humans and dogs that have documented antibodies within joint tissues as a result of vaccination. There was a study done in 1999 at Purdue University that evaluated puppies that were administered various different vaccinations. They had one group that had just the rabies, one group that had just the distemper combo, and another group that had both, as well as controls that did not have any vaccination. And these authors concluded that the vaccinated puppies, but not the unvaccinated puppies, developed autoantibodies to their own collagen. Other studies have found antibodies to collagen in 75 to 80% of animals with other joint diseases such as rheumatoid arthritis, and at least 50% of those with other types of arthritis. There was a study on dogs with cruciate disease that showed a significantly increased level of autoantibodies in these dogs to collagen. They also had higher levels of anti-collagen antibodies within the joint fluid. These authors concluded that anti-collagen complexes were present in all joint disorders. This doesn't mean that all patients that have joint disease have these antibodies, just means that they were found in all different types of joint disorders that were investigated. Actually, in dogs with cruciate tears in one leg, the studies that have determined whether there were elevated anti-collagen antibodies in the other leg were able to accurately predict with dogs that had elevated levels which dogs would go on to then tear a cruciate ligament in the other leg. I find interesting that after all this study, the author's conclusion in a majority of these studies is that the role of autoimmunity is unclear and that more investigation is warranted. And I wonder what their conclusions might have been if their studies were not sponsored by one of the major vaccine manufacturers. But unfortunately, that's the way our world works sometimes. Let's move on to processed diets. So processed diets can contribute to joint inflammation in that they can create an overall pro-inflammatory state in the body. This inflammation begins in the gut, which has trouble recognizing the food substances because they're so altered from what nature intended. These altered substances are more difficult for the gut to digest and assimilate. Some of the ingredients in many dry foods are also processed multiple times, increasing their tendency to cause inflammation and decreasing their usability or bioavailability. These pre-processed ingredients include meat meals, corn meals, soybean meals, and pretty much any substance accompanied by the word meal, with the exception of eggshell meal, which is just ground up eggshells. It's not subjected to the high temperatures and pressures of these other products. Let's talk about cartilage. So cartilage is a connective tissue consisting of a dense matrix of collagen fibers and elastic fibers that are embedded in this rubbery ground substance. And the matrix is produced by cells called chondroblasts, which then, once they're finished, become embedded and they're called chondrocytes. Cartilage acts almost like a sponge. It's made up of this resilient mesh of something called glycosaminoglycans, or GAGs for short, held together by sulfur-containing bonds. Studies have determined actually that arthritic cartilage contains significantly less sulfur than healthy cartilage. During compression of the joint, cartilage slightly compresses, then slightly expands, acting as a shock absorber. Think of it as like one of those gel insoles you see on TV. The resiliency of cartilage is highly dependent on many factors, and I apologize, this slide did not look like that when I uploaded it, but it got a little changed. So that says glycosaminoglycan. So some of these things that the resiliency depends on would be water or hydration status, and the glycosaminoglycans, which are polysaccharide molecules. They are highly negatively charged, which leads to increased osmotic pressure, or they draw in water. And this contributes to the high viscosity or the thickness of the fluid. And these GAGs include things like hyaluronin, or also known as hyaluronic acid, chondroitin sulfate, and others. Glucosamine itself is not a GAG, but it is a precursor or a building block to other GAGs. So what really happens in a damaged joint? Well, normal joints have the cushioning of the healthy cartilage. Arthritis, the term, is sort of a catch-all phrase indicating any disease that results in inflammation of a joint or joints. An osteoarthritic joint has damaged cartilage, hence some bone hits bone, and this is painful. Immune-mediated arthritis involves a lot of inflammation of the joint, which can thin the joint fluid and ultimately lead to osteoarthritis. It can also have bone erosion or eating away, which is very painful, and immune-mediated arthritis can lead to osteoarthritis. Some possible causes of immune-mediated arthritis include over-vaccination, chronic inflammation from processed diet, and other illnesses, things like Lyme disease or anaplasmosis. Finally, we're getting to the good stuff. What can help with arthritis? Well, you can have conventional treatment. Conventional therapies include NSAIDs, or the non-steroidal anti-inflammatory drugs. Things like carprofen, aka Rimadyl, meloxicam, aka Meloxidil and Metacam, Previcox, Deramax, this one for cats called Onsior. There are, while these NSAID drugs can help with pain and inflammation, particularly in the short term, they need to be administered daily, and they can have detrimental effects on the liver, the kidneys, and the gastrointestinal system. We have other pain medications, things such as gabapentin, tramadol, and amantadine. I have found that these three medications, though, as well as any others that are narcotic-like, have a lot of behavioral side effects, things like sedation, dizziness, and sometimes even just really strange behavior where they'll have accidents in the house when they've never ever done that before. We have joint supplements, and conventional medicine has caught on a little bit in that they do use some of these joint supplements. They're aware of glucosamine and chondroitin and MSM, which acts as a sulfur donor. But caution with any of these soft chews, as they are usually preserved with chemicals such as BHA and BHT, which have been known to sometimes cause cancer. So what else can help? Well, we have supplements that can help decrease overall inflammation, things like omega-3 fatty acid supplements. But be sure that the company follows FDA good manufacturing practices whenever you get any nutritional supplement, because anyone can slap a label on it and say it contains XYZ when it really might not. So I recommend either wild Alaskan salmon oil or small fish oils. Krill oil is not sustainable for the planet, as krill are an endangered species and there are other fish that require them for survival. So I recommend avoiding krill oil when possible. Hyaluronic acid, aka hyaluronin, is available in an oral formula. As we saw in slide number 8, hyaluronin is a vital part of the cartilage matrix. This substance can also, when in a sterile solution, can be injected directly into joints. And this is done more frequently in horses. I don't really see it too much in small animals. Polysulfated glycosaminoglycans, products such as Adequin or the generic injectable formulation. These injected either under the skin or in the muscle. They're usually, we teach the clients how to do this, and it delivers some of the building blocks of the cartilage matrix. So just as in people with arthritis, mild to moderate physical activity can help. Manual therapy, such as massage and stretching. Strengthening exercises to help build muscle, things such as a sit to stand, crawling, backwards walking, stairs or paws up kind of thing, peanut instability exercises. All of these can sometimes help. However, you need to consult with somebody trained in canine rehabilitation to avoid injuring your pet by doing an exercise that's not appropriate for them. Lastly, water therapy in the form of either underwater treadmill or even swimming can help. Other things that can help include weight loss, especially if the patient is obese or heavy. It eases stress on the joints. Laser therapy. Laser therapy helps to decrease pain and inflammation using specific wavelengths of light energy, resulting in enhanced blood flow, increased cellular healing, and cellular function. The Assisi loop. The Assisi loop helps to decrease pain and inflammation using weak pulsed electromagnetic therapy, electromagnetic energy, rather, which also results in enhanced blood flow and increased cellular function. Acupuncture can also be helpful. Acupuncture can help decrease pain and inflammation through, again, enhanced blood flow, but also the release of trapped substances that can cause pain, things like lactic acid. Chiropractic can help. It can help maintain mobility of the good joints and realign fixations. Homeopathy can help. Homeopathy can help the body heal itself by treating the system as a whole rather than this or that symptom. And it may be especially helpful when vaccination has played a role in worsening of this condition. For more information, please view our webinar on homeopathy available on our YouTube channel. Other things that can help include ozone and UV blood therapy. Especially this can be helpful in cases of immune-mediated disease, but also in cases of osteoarthritis. So for more information on ozone and UV blood therapy, please view our webinar on this subject, also available on our YouTube channel. Minimizing vaccinations. This will decrease immune destruction of ligaments and connective tissues and is very important for any patient with arthritis, including humans. Herbal medicine, herbal formulas. There are several herbal formulas that can help with inflammation and pain. For more information about herbal medicine, Please view our webinar on this subject available on our YouTube channel. There are some more invasive and costly options, though they're sometimes warranted. Things such as stem cell therapy. This requires harvesting stem cells, which is a surgery, storage and prep, and re-injection. It's very costly. It's somewhat invasive, but it can be warranted in certain cases. You can do surgeries to stabilize, particularly in the knee area, and sometimes they can even do joint replacement in the hip. As you can see, there are many, many options to help pets with joint disease, from joint supplements and other very simple things that can be done, to home injections, to rehabilitation, to more invasive things such as stem cell therapy and surgery. So determining what's best for your pet will be an individualized decision at Natural Pet based on the particular issues that your pet may have, in addition to their joint problems, as well as their specific injury or joint tissue problem. We do not treat every case with the same basic issue the same way, as the true cause may not be the same for all patients. Just an example would be 2 dogs with cruciate ligament injury. So one of these dogs may be obese, and that is a true cause, while the other one may be slim, yet grossly over-vaccinated. And so immune destruction of the ligament may be the true cause in that patient, and these patients would likely be treated somewhat differently. We now offer full rehabilitation consultations for $199, and this includes an in-depth analysis of not just your pet's primarily affected joint, but all of the other compensatory effects such as muscle spasms and tightness that can result from the primary problem. Veterinarians not trained in rehabilitation medicine are unaware of these other issues and therefore do not address them. If you or someone you know has a pet, dog or cat, or even rabbit with joint disease, please call us at 815-929-9393 and we will be happy to help them. If you have any questions, since this is not a live webinar, please email them to us at info, that's info, at naturalpetfamily.com. Thank you very much. Or you can call us at 815-929-9393.